can move on to the question and answer session. It looks like we have about 15 minutes for question and answer, and I'm going to introduce our moderator for this portion, Dr. Jackie James. Jackie is a director of the Sloan Research Network on Aging and Work and the research professor in the Lynch School of Education at Boston College. Her research is focused on the meaning and experience of work, gender roles and stereotypes, adult development, perceptions of older workers, and emerging retirement issues. Thanks so much, Jackie.
Thank you. And thank you to those panelists. That was just fantastic. We're so grateful to you for joining us and for presenting that wonderful work that you've all been doing. I'm having trouble with my video, I'm sorry. Okay, so a lot of questions came in, and I tried to answer some of them as I could while things were going on, short ones. But if I didn't answer some that I don't get to here, please do email us and we will get back to you. My first question is addressed to Kendra, because people were asking something about the extent to which, you were talking about the barriers and the constraints that Black low-wage workers are faced with, and people are saying, isn't that going to get exponentially worse if the Affordable Care Act is eliminated? Do you want to talk about that a little bit?
Yes, thank you, Jackie, and thank you to the person who asked that question. I mean, I think the obvious answer is, of course. If it's not replaced or re-envisioned in some way, the Affordable Care Act will, or the lack of the Affordable Care Act will leave so many Americans in a very dire situation, especially where one of the conditions was that you did not have to have pre-existing conditions. And so what we know in our research is that, chronic conditions start as early as 35. 50 is the age where you get more than one chronic condition. Medicare, which takes care of those over 65, you're just going to have a population that is not living to the age of 65 so that they can garner the benefits of the access of healthcare in that way. And so I think a lot of people should be concerned. And that's why, of course, that was one of the main issues on the political platform this year. And so I don't have any answers for the person who answered, other than, of course, and I hope that, our government is creative in finding a way to support older workers and workers with disabilities.
Thank you. And one more, just to comment too, in our audience are people who have lost their jobs that they believe are due to age in the middle of the COVID pandemic, and they do not believe they were given honest answers by their employers. Mm-hmm. Do you have comments about that? Is that a common experience?
Well, like one of the reports that I mentioned in my talk, Black workers especially are facing retaliation at higher rates in the face of COVID. This is when, they report people not following protocol or, any other little issue. And so this is a case where I think it's fair to say that racism, sexism, and other isms sneak into the workplace and give employers an excuse to get rid of workers. Ageism is a huge issue that everyone on the committee has been tackling for a number of years. And so unfortunately, and another thing with COVID has been so recent and so fast that we have not had an opportunity to really grasp what's going on in the workplaces. We're still in the very early ages of gathering data and understanding the short-term implications of COVID, not even to mention what the long-term implications could be. So again, I don't have the best answer because COVID is just so new and so fresh and so devastating. But we hope to, that's what this team, the panelists here are working towards, a better understanding of this pandemic, a better understanding of the situation that older workers deal with, so we can better respond to the needs of this very, very essential group.
Yes, thank you. I think those are very good answers. Thank you, Kendra. And then my next question is for Theo. This is a question several people wanted to know, Theo, is, you talked about the happiness of the older Latinx population, and people want to know if younger generations of Latinos will be as happy or whether they have assimilated into the US swine that we know about. Those are my words, not theirs.
Thank you for that question. It's interesting. I've looked at the happiness of working age immigrants compared to the native born population. And what I found is that they are less happy. I only have found the older adults happier than I only have found this paradigm, this paradox with the older adult population. Keep in mind that aging makes us happier. As we age, we all become happier in general. It's the Latinos that is when it flips. It's Latinos that become the happiest of all. My hypothesis is that they have a life, what they do give them more meaning and purpose. They derive more meaning and purpose from what they do than other groups. But now that I'm conducting these in-depth interviews, I am seeing that there is a lot of variability by country of origin, time in the United States, but still there is a general trend that they are very satisfied with their lives in the United States because of the meaning and purpose that they derive. They are very satisfied with what they have accomplished in life.
Do you think that this, any of this happiness factor is about the different level of family involvement? If you could answer quickly so I can get to...
Yes, in our aggregate data, in our national data, we saw that realizing certain activities like cooking, for instance, talking about work, Latinos derive more happiness working when they collaborate with colleagues than working by themselves. They derive more happiness and more meaning, specifically more meaning when they are involved in activities that require collaboration and they do these activities with others.
And real quickly, can I ask you one more real quickly, because I want to get to a question for Abby as well. What kinds of questions did you ask to get at the happiness that you described?
I use a question that has been, I have two questions. In the first studies where we look at general trends with the health and retirement data, we look at how satisfied you are with your life overall. That measure is literature showed is an established measure for life satisfaction, the cognitive evaluation. In the second study, where we use the American Times Youth Survey, where we follow people for 24 hours, we ask people how satisfied you are with what you do. For 24 hours, we measure what you are involved with and with whom, and how much meaning, what is the meaning you derive from this. And now in the qualitative interviews that we are doing is we ask them how satisfied they are with their life, what and why. What makes you so satisfied? What are those factors?
Thank you so much for that, Rocio.
My pleasure.
Abby, somebody says, I'm thinking about how varied the populations of people are who are not working at 50. Some people are the poorest they've ever been because of losing their jobs. Some other people are better off financially because they have Social Security and Medicare and so on. And yet we have these very few undifferentiated public training programs. Can you address how such programs should be designed given all these differences?
So, what we heard over and over from our key informants is that we need to have multiple opportunities for learning, adult education and training. So, and that really calls back to thinking about formal non-formal and informal learning opportunities. And our graph showed that, again, 63%, that was specifically Americans, preferred programs that weren't what we would call formal. They weren't looking specifically for degrees, but they were looking for opportunities for a certificate or a certification or a training that would help them advance in their career, whether that's, you know, a brief training on how to use Excel even. So what we heard was important is that all of those opportunities are available for our adult learners, and really focusing on non-formal education would be things, again, that they are organized learning opportunities. They might take place in a workforce or even in a classroom, but they don't necessarily lead to a degree. And then what we heard from several countries were around opportunities for maybe even more informal learning. So we heard from Australia about men's sheds that were important not only for learning opportunities, but really for social engagement, which of course now is incredibly important. And then of course the challenges those organizations have are how do they continue to engage their adult learners even in a virtual setting if that continues to be necessary.
Okay, thank you.
And I think one last thing the only thing that I would add to what Abby said is to the question of how can these programs be designed? They should just be designed primarily with the community of interest at the center of it. Think about what the communities that you're trying to engage with, what they would be interested in, how you can reach them, and what they want to be involved in. Because those are major elements that play a factor into whether someone's going to get into something. If they're going to be involved, if they're going to seek it out. You can tell when someone is kind of going at something and it doesn't fit your mold or what you're looking for. So getting in touch with the community of interest is crucial to developing any program, any development going forward.
Thank you. Thank you for that clarification. And another comment someone made had to do with that is if you offer somebody a second chance that looks just like the first chance, what's going to make them interested in taking that up? It's got to be something different, right? Yeah. So we're almost out of time. I did want to ask Cal if he could address, you know, I think most of you, all of you on this panel, think about your work in the narrow confines of your research and your academic circles. What do you think a non-academic audience needs to know on the basis of the work that you do? And I don't think I have time for everybody to answer that, but I'd love to start with Cal and ask him to answer that. And then if we have time, maybe one more.
You know, one of the biggest things I'd say is we don't realize just how many people work for themselves. And so if we're looking at people over the age of 50, it's 1 out of every 5 people work for themselves who are in the labor force. And that's giant. And they are not protected. But even if we just expand this and we look at the entire life course, that remains to be true. And so there is a large portion of our labor force who is working, but is unable to afford their health care that they would normally get if they worked for someone else, for a decently sized organization that gave them healthcare benefits. They're not saving for retirement. And so even if we look at self-employed people in their 20s and 30s and 40s, I have grave concerns for their future financial security and their future health, because we have created a system that is not supporting them. And so to me, like, you know, yeah, you're right. We can get into our little niches with our research, but this is very important because we are not providing a safety net for one of the key creators of jobs in our country, which is entrepreneurs. And if we wanted to create more jobs, I would argue we should support our entrepreneurs and our self-employed people.
Thank you. And I'm going to ask one more. Kendra, I want to ask you, I know that you get, you offered so much information about the barriers, the constraints that Black low-wage workers face. And I know that there would be people who would say that the kinds of jobs they have don't lead to having this idea of meaning and purpose. Can you address that in a 1-minute answer as we close?
Yes, I can. And one thing, this is an excellent question. One thing, there's this huge misconception that low-wage workers do not have dignity at work. and they do. One of the main things that come out of my talks is how much pride and dignity and respect and how much meaning that these individuals get from doing their jobs and doing their jobs well. And having a health condition is so frustrating to them because it limits them from being able to do the jobs that they have so much pride in doing those things well. And so going back to the whole thing about meaning and purpose, just because you're a low-wage worker, just because you're in a physical job does not mean you're a devalued person in society, and that you're very meaningful and have a very, very meaningful contribution. And just one last thing I wanted to tag on what Cal just said. I would like non-academics to know or to realize that you have a group of researchers out here who are really advocating for them. One of the things that I really appreciate and enjoy when I talk about my research with someone, they say, "Oh, that's my grandmother," or, "Oh, that's a situation I know, my mom is in," and they're just so excited that their marginalized story is centered in someone's research agenda, and that they are meaningful and purposeful in someone's research and someone's career. And so that's really meaningful beyond the realm of academia as well.
Well, I think that is a fantastic note to end on, and I am so inspired by the work that all of you are doing, and Tina and Cal and Doug and all of us appreciate so much your willingness to join us today. I'm going to turn it back over to, I believe it's Doug now, to close out the program. Thank you all for joining us again.
Thank you, Jackie, and thank you, Tina, and all the presenters. It says I'm not able to start my video, but maybe I can now. Well, if you can hear my voice, we'll do without the face. What I would like to do is to say a big thank you, first of all, to Tina and Jackie and all of the presenters, and to all of you who have attended and asked such good questions. You know, this has been a very rich and enlightening discussion, and it would be wonderful if we could find a way to translate the research agenda into an agenda for action. Because we're going to change these things only if all of us become engaged and find steps to take, one at a time, moving forward to deal with these structural issues. Because without that, we're not going to see change. And of course, this is a hugely complicated challenge, because as we've identified in this whole notion of intersectionality, there are lots of little pieces, and they're moving and they're interrelated. But we have to understand how they interrelate and what the opportunities are to make change over time. And I think that would be a wonderful way to build on the start that we've made today in terms of understanding this concept. So in closing, I want to remind you that we have recorded this and we'll be sending you the link next week, so that you can refer to it, you can share it, you can listen to it again. And we also will include the links that have been noted in the various presentations. We want to make you aware that this coming March, we will have our next program for the Future of Aging series. This one will focus on housing. The theme will be finding your way to home, new options for later life. And this is another issue that's brought into stark relief by the pandemic, and we'll explore the range of options for safe, affordable housing with reasonable access to services and quality of life. And by registering for this webinar, you'll be among the first to know the details for this next one. Finally, I want to thank our sponsors again, Encore Boston Network, the Center on Aging and Work at Boston College, the CNAP Alliance, the Fuss Center for Research on Aging and Intergenerational Studies at LaSalle University, and the Massachusetts Gerontology Association. You'll find lots of additional resources on their respective websites, and we'll send you those links next week. So thanks again from the Future of Aging Coalition, and we hope you have a wonderful afternoon.